Hello everyone and welcome to Module 4. So this week our focus will be on women's health, and with that we are going to be focusing on just two chapters. Those two chapters are Chapter 33, pages 705 to 721, Chapter 38, pages 858 to 873. So Chapter 33 is what I'm going to start with, and that is actually going to be discussing the female reproductive system, as well as some of the primary sex organs, such as the ovaries, the accessory organs, which include your uterus, fallopian tube, vagina, vulva, and breasts. So what I'm going to do is I'm going to take just a few minutes and kind of talk about each of those pieces individually so we get a better understanding of what those items look like. So the first thing that we have are the ovaries. These are we have two of them in women, one on each side, one on the right, one on the left. They are located on either side of the uterus, and they look very similar to that of an almond. Now your ovaries have two main functions. The first one is to produce an ova or an egg, and they also help to produce hormones. The uterus is a hollow pear-shaped organ that is located in the front of the pelvic cavity just above the bladder. The uterus has three main functions. First is that once a month it goes through menstruation, or the discharge of blood. Second, it provides nourishment and protection to the fetus during pregnancy. And the third and final function is that during labor, it contracts to help birth the baby. Fallopian tubes are next, and these extend from each side of the uterus and bend inwards towards the ovaries. Their function is to help move the egg from the ovary to the uterus. And each of these fallopian tubes is about 4.5 inches long and about 1/4 of an inch wide. So they're very tiny, speaking in terms of being wide, but they are fairly long. And the last one that we have is the vagina. This is composed of muscle and membranes. It extends from the uterus, and it's typically about 4 to 6 inches long. Now the vagina has three main functions. The first one is it serves as the organ for female copulation. It is a passageway of discharge for blood during menstrual cycles. And it's a passageway for birth for babies. Now all of these that you see here make up what we call the internal organs of the female reproductive system. The next ones that we are going to talk about are your external organs. So we have the vulva, which is usually made up of 5 different organs, such as the mons pubis, labia majora, labia minora, the vestibule, and the clitoris. All 5 of those make up your vulva. Then we also have the breasts, which are round structures made up of fatty tissue that protrude from the chest area. Each breast has numerous glands that form 12 to 15 tissue lobes. The areola is the dark pigmented circle of skin found on each breast, typically in the center. And the nipple is the elevated area of the center of the areola. All right, so again, Chapter 33 was only talking about the female organs that make up that reproductive system. So we're now going to start talking about Chapter 38, which is helping you learn about gynecology. Now, gynecology is the branch of medicine that deals with disorders and diseases of the female reproductive system. An exam of the female reproductive system will include the breast and pelvic exams. A breast exam will help to detect cancer, breast cancer. So the patients will lie flat on their backs with their one hand above their head. This allows the physician to examine lymph nodes under the armpit. And providers suggest that patients perform a breast self-exam, or a BSE, starting in their 20s. And this should be performed every month about 1 week after the menstrual cycle ends. A pelvic exam is both an internal and external exam. Generally, what we do is we call it a pap smear, and it helps to diagnose cervical cancer. Now, we also have to deal with things such as the menstrual cycle. And the menstrual cycle is really when you start to have your periods, okay? Typically, it starts around puberty age, so for some that may be earlier than others. Typically, though, it's probably around ages 12 to 15, okay? And the typical menstrual cycle will last about 28 days, but it can go up to 35, and it's always on a repetitive cycle, okay? With this cycle, there are 4 phases. And typically, the first phase that we always start with is the menstruation phase. So that's when you actually get your period. And that can last from day 1 to day 4 or day 1 to day 6. So typically, it's somewhere in that 1 to 6, 1 to 7 range. Then you move to your follicular phase. And what happens during the follicular phase is that the endometrium starts to thicken up. And what that happens is it's trying to get your body ready for ovulation and to potentially take on a fetus. So what will happen then is that will last till about day 14. So now we're 2 weeks in. Your ovulation phase comes next, and this is typically where an egg is produced and then released. That can last up to another 7 days. And then the final phase is the luteal phase. Now, if conception has happened, this is where your progesterone levels will be at their highest to help that baby start to develop. But if one hasn't occurred, your progesterone is still made, but then what happens is your cycle starts back over with the menstruation phase. We're also going to talk about a little bit more about the breast exam. We did talk about how you have to teach women how to do their self-breast exams, which is always very important. They also have their clinical breast exams as part of their regular routine physical exams with their gynecologist or their primary doctor. But one other thing that we need to talk about is that women need to start having mammograms. And we typically start this around age 40 unless the female has a family history of breast cancer with immediate family, so mothers, maybe grandmothers, maybe fathers, whatever that might be. If they're blood relations that are close, not married in, have any history of breast cancer, we typically do this a little bit earlier. Or if someone's actually having some signs and symptoms of breast cancer, we would then do this earlier. Okay. We talked already about the Pap test and testing for cervical cancer. One thing I want to kind of point out here is that part of a Pap smear isn't necessarily to check for STDs or sexually transmitted diseases, but it's becoming a little bit more pronounced that doctors are doing this more often, just because some cervical cancers or some STDs can come and we won't even know about them. We won't have signs and symptoms right away. So this is becoming something that is more widely known. And if your doctor ever does a Pap test and it comes back abnormal, what we typically then do is we perform what we call a colposcopy. Now, a colposcopy is where they take an actual tissue sample and they do a biopsy on it to see if you have any cervical cancer markers. They'll also probably at that point draw some blood for cancer markers. Now, the last thing that does happen in gynecology is we do have a lot of prenatal care, partly because we're dealing with women who become pregnant. So every time we give prenatal care, it's typically to women who are planning on either becoming pregnant or who are actually pregnant. You can start prenatal care prior to actually becoming pregnant because it helps your body to prepare for getting ready to become pregnant. We teach them about maintaining a healthy lifestyle during their pregnancy. So we tell them to make sure they're not smoking, drinking alcohol, taking any medications that are unnecessary, and maybe starting the fact that they need to take a prenatal vitamin. Now, a typical pregnancy is about 40 weeks long, and we divide that into 3 trimesters. Most of us are women, so we already kind of know this, and maybe most of you have children, so you already know this as well. But what you might not know is one way that we determine an estimated delivery date is we use something called Naegele's rule. And with Naegele's rule, what we do is we take the last menstrual cycle that a woman had, and we add 7 days to the last day. So for example, if let's say their last pap smear, or I'm sorry, their last menstrual cycle was the 21st of August, let's say. What we would do is we would add 7 days to the 21st, so that gives us the 28th. We would take away 3 months, so we'd go back to May instead of August, so minus 3 months is May, and we add a year. So that means that May 28th of 2018 would be this woman's delivery date, estimated. Now, a lot of things kind of come into play in that. That doesn't necessarily mean that's when it is their delivery date. Many things can affect that. All right, guys, what I want to do is take just a few minutes and talk about what your homework is for this week. So this week you have 1 discussion board, and your discussion board is focused on that of high-risk pregnancies. So your initial post will be due on Tuesday, October 24th by midnight, and you'll need to reply to at least 1 classmate no later than October 28th by midnight. Now, in your discussion post, you are going to talk about, does age really matter when it comes to the female reproductive system? And you need to tell me why or why not. You also need to talk about why conception after a certain age is considered more high risk. Okay? Now, you'll need to do some research, so that means that you'll need to make sure that you include your references and your in-text citations with this. That way, I know that your sources and the information you're providing are both credible and reliable. You also have 1 quiz this week. It is over both chapter 33 and 38, so all about the female reproductive system here. It is 10 multiple choice questions, and you get a 10-minute time limit, okay? You will need to have that completed no later than Sunday, October 29th by midnight. All right, guys, that is all that I have for you this week. If you do have any questions or comments or concerns, please make sure you're reaching out to me right away, and I can answer those either via email, or you can give me a call at my direct line, which you can find on the course homepage in the upper right-hand corner next to my photo. I hope you all have a wonderful Module 4, and women's health is definitely a fun unit to work in, so enjoy everything that you do in your lab classes, guys. Bye now.